good people, welcome back to my channel. First of all, I know that I am crusty. I know that. You don't have to tell me. I did it on purpose because I was like, I miss my good people. I have not done a video in so long, and I thought to myself, I'm gonna make a video when I get my good stuff. Wait, where's the camera? Okay, I can see where it is now. I was like, until I get my good shandas, that's what I'm gonna make my videos and stuff like that. And then I realized that my good shandas is gonna come in 2-3 weeks. I don't know, that's so long, but the last time I posted was years ago. So today I'm just gonna come to you guys to talk about the good stuff, which is okay, I'm so dramatic, but today I'm just gonna talk about signs of labor, and I'm gonna talk about what to pack, right? You're in labor, so now what do you get? And no, you don't pack when you realize that you're in labor. You pack, and sorry for the, you know what, don't judge my crustiness, don't judge what's happening, do not judge anything, okay? That came out very, very violently, but that's not what I mean. You guys know that, right? Okay, anyway, so how do you know that it's time? You're in labor, no, your baby's coming, yeah, the time that you've been waiting for, it's here. What happening? How do you know? What do you grab, right? Okay, so let's just firstly start with the signs of labor, because that's what happens first before you grab your bag. But you have to pack your bag before you get in labor. But like, it's fine. Let's talk. How do you know that you are in labor? All you need to know is, how do you know that you're in labor? So that's all that you need to know. So when you're in labor, there are 4 signs of labor. Ding, ding, ding. I think I might have mentioned them in one of my videos, but this one is specifically for that. Ne? So it's 4 signs. Ding, ding, ding. And then one thing you need to keep in mind is that when it comes to labor, it's not A, B, C, D, or 1, 2, 3, 4, or I don't know, from A to Z. Anything can happen. You can get B, C, A, B. I mean, B, C, A, D, or you can get C, A, D, whatever, right? So you can get anything before the other. It's not a straight line. So other people get this sign, others get the other sign. So the most important thing is that out of all these 4 signs, when you get one sign, you go to your nearest clinic. If you are you get to your nearest clinic, you go to your gynae or whoever is going to give birth to you. You know your plans and whatever, depending on what you have decided or what you have planned, right? So you need to get there as soon as you get those signs, because you will never know when when the baby is going to be delivered, because people are very different. So you need to pay attention to the signs. Okay, so first of all, you can have your water break, the normal one on TV. And guys, FYI, I know you guys watch TV, you see what happens on Mobango, and you see the lady, the water breaks, and then she gives birth. That's not how it happens, boo. That is not how it happens. You don't break your water now and then jiggy give birth in a few seconds. It doesn't happen like that. It can take a while. Everyone is different. Every pregnancy is different. Everything is different. So you will never know. The only person who knows is that man upstairs, okay? And also the healthcare worker doesn't know. So you can't ask, Sister Maeve, when am I going to deliver? I don't know. If I were God, I swear I would tell you, but I'm not. So I do not know. Anyway, so if your water breaks, you go to the hospital or clinic or wherever you were told to go to. And the most important thing, guys, when they said go to a hospital, you need to go to a hospital. You have primary care, secondary, tertiary, quaternary. So there are different levels of care depending on the healthcare workers that are available there. So if you were told to go to a hospital and you decide to go to a clinic, we don't have things in the clinic that people have in the hospital. So it's very important for you to go specifically where they said you should go. Anyway, so if your water breaks, number 1, you go to the clinic, hospital, whatever. Or if you start having pains. So the pains, most of my patients, they define them as period pains, you know? So your low abdominal pains, they have pains right on the low abdomen, right there, period pains. Yeah, so and then you can get backache. Other people get backache because of the pressure the baby puts on your sacrum when the baby's head descends. But yeah, whatever. So backache or lower abdominal pains. And then another sign would be show, what we call show. So show is that mucus discharge. Discharge yamamina. The one that looks like mucus nyana, so it's very thick. That's when the mucus plug comes out. So it comes out as that. That's why it's called mucus plug, because it seems like mucus. You call it the mucus discharge because now it's out of your body, so it's called a discharge. But it's out of your body view, doesn't matter. So yeah, the mucus plug comes out, which we call the mucusy discharge. It might be with a little blood or without blood, or if you bleed. So sometimes other people bleed. It happens. So if you see that bleeding, you come to the hospital. Remember when I mentioned it in danger signs, bleeding is also a danger sign. So no matter what, when you bleed, you need to end up in the hospital, clinic, whatever, wherever you're supposed to give birth at. So those are the 4 signs of labor. So anything that happens before the other, you go there immediately. And the reason I say this is because people are different. You get women who would break their water at 2 o'clock. And then at 4, they start having pains. At 4 o'clock when they have pains, 5 minutes past 4, the baby comes. Other people have pains and then the water breaks when they're about to give birth. Sometimes as a healthcare practitioner, you have to break the water yourself. That's what I'm saying. Whatever happens first, you come to the clinic. We would rather tell you that, boo, you are not in labor. It was just 1, 2, 3. Sometimes your STIs, your low abdominal pain, STIs can cause the low abdominal pain. So yeah, it might be that. What am I saying? So it might be that, right? What do you need in your baby's bag, right? So what you need most importantly is your baby's clothes. Honey, you need your baby's clothes. And I could need for you to pack an entire suitcase. Are you going on a vacation? Are you going on a vacation? Is that a vacation? No, it's not. You're just going to go there and give birth. Depending on where you're giving birth. If you give birth in a hospital, sometimes they keep you there for a few days. So you might need a bigger bag, but you really do not need that vacation suitcase. You're not going on a vacation. Anyway, all you need is your baby's clothes. By baby's clothes, it means, especially during winter, you're gonna need your baby's vests. So the long sleeved vests are better. They're proper, especially now during winter. Winter's about to end though, but it doesn't matter. So your vest, get 2. The reason we say bring 2 is because sometimes you will think that you're having 1 baby, and then ta-da, your second baby pulls through. So you'll never know. So just bring 2 or 4 of each, depending on your hospital stay. If you can discuss it with your healthcare worker so that you know if you're at a clinic, you're definitely going to be kept for 6 hours after giving birth, depending on, yeah, we'll talk about that another time. So if you're in a clinic, you'll be kept for about 6 hours tops. If you are at a hospital, sometimes they keep you for a day, 2, or whatever. So depending on that, just talk to your healthcare worker. They'll tell you how long it will be. So your baby's clothes, I get distracted. Okay, so your baby's clothes, you'll need your 2 vests or 4. You will need your socks, your baby's socks. I normally say bring, if it's for one, if you bring 2 vests, bring 4 pairs of socks, because most of the time we use those socks as hand gloves. So there will be socks and hand gloves. So that's why you need 2 pairs for the baby. Yeah? So the socks and your crawler or your jersey and pants. So either you get a crawler, it's a one thing, or you get your jersey and pants, warm pants at that. And then you're going to need a small blanket. I forgot what they call them. Those very thin blankets for babies. And then get a big, those thick winter blankets. So also get that. And then you need, obviously, your baby's Pampers. So whatever the baby's going to be wearing, your nappies. Let me not say Pampers. Your baby's nappies. So you're going to need nappies. Bring 6 or more nappies. And then what else are you going to need? Oh, the most very important thing that you need to bring is your baby's hat. It's very important. And getting those cute little ones that cover the ears, that would be perfect. So just get that hat. That's very important. So the most important thing about getting a hat for your baby, the reason the baby's head is the first thing that comes out of your vagina, sorry to put it like that, but the reason it comes out first is because it's the biggest thing Like, it's the biggest part of your baby. So that's why it comes out first, so that the body will just, it'll just come out, because the biggest part is been out. So basically, the head, if your baby's head loses heat, it's done. Your baby is gonna feel cold, because it's the biggest thing in their body from head to toe. The head is the biggest thing compared to the body. Okay, so you need to get what was I saying again? The hat. So that's the most important thing. So your baby must have a hat, a vest, since they don't need bras because they don't have breasts. But anyway, a vest, and either a jersey or I almost said a onesie. It's like a onesie though. A crawler, and your pampers or like nappies, and your either pants or the crawler itself, and 2 pairs of socks. That's what your baby's gonna wear. If you get twins, then you need to bring twice those things, but it's a better choice to bring twice, because you don't know whether you're gonna have a twin or not, because sometimes you will be sonared and they will not find anything, only to find out after birth to repalpate and feel like there's another child. So you might just get twins. So just to be safe, bring 2 of everything. And then for yourself, it depends where you will be delivering, where you'll be giving birth. Okay, so for yourself, you need pads. Guys, don't buy those maternity pads. They're so thick. I couldn't need, hey? We normally advise women to buy those Dr. White pads. I want to tell you guys why, but I feel like, no, I'm not going to scare you guys, because I'm sure different facilities work differently, and different facilities have different things. Where I work, we don't really have enough things, so we sometimes have to use those pads to like suture you and stuff. So it's best to get Dr. White's because they're thin, so when we suture you, we don't have to really struggle. Yeah, so buy Dr. White's, and if they're not written Dr. White's, they're not Dr. White's. So buy 2 packs of Dr. White's. And I'm not promoting anything or anyone, FYI. I'm not presenting Pampers. I'm not presenting your what's this, Dr. White's. It's just what we use. Okay, and then for yourself, and the facility I work in, you don't have to bath. So just bring your toiletry, depending on where you'll be working. So yeah, bring your toiletry, and you don't really need toiletries for your baby, like your soap, your face cloth, unless you're going to be wiping the baby's puke. But you don't need those things, because you're not going to bath your baby at your first day and your second days. Just let that baby's immune system be boosted by what the baby came out with from your vajay, okay, from your uterus, okay. So another thing, so it's your toiletries. You need 2 night dresses. So now the reason we say bring 2 is because when you bring 1, when you deliver, it might get wet. Sometimes I don't even know how to put it. Yeah, so like when you deliver, it might get wet. It might have blood stains. Maybe if your water breaks and you were sitting, it gets wet. Maybe you start bleeding. Whatever happens, you will have the second one for you to wear after birth, né? And then another thing, you can bring your gown as well. So you can bring 2 night dresses and a gown, or 1 night dress and a gown, but like just bring 2 night dresses and a gown just for in case. And if it's cold, even if it's not cold, just bring something warm. Bring your blankies, because you never know if you're going to sleep there. So you can bring your polo fleeces, depending again on which facility you'll be at. The facility I work at does not have a lot of things, so you will need something warm to wear at night, because we just have those very light linens. So if it's cold, you're going to need something warm to wear. And then another thing, what am I forgetting? So yeah, just find out what your facility wants you to pack. Specifically, your facility wants you to pack. But the most important thing is to get everything for your baby, the clothes and everything, and for yourself, and your panties, because when you leave, you're gonna need the panties. But while you're hospitalized in labor, you don't wear a panty, because if you wear a panty, what if your baby comes out before the time you thought your baby's gonna come out? Then your baby's just gonna be there in your panty. You have to take off your panty first before you can deliver the baby. So that's just a lot. And your sleepers, bring your comfortable sleepers. That's very important, especially if you have your legs swollen and stuff. Just bring comfortable shoes that these shoes are very comfortable. They're not that hard. Bring 2 pairs as well, because if your water breaks while you're standing, you will need another pair of shoes. Let's see if there's something that I'm forgetting. Oh, the night dresses that you get, if it's a gown, perfect, because you'll be able to take out your boob. But you can't buy a night dress that looks like my top, because now you have to take out your boobs. It's too much. When you breastfeed, you should be comfortable. You shouldn't be trying to take out the boob. Just make sure that you'll be as comfortable as possible, and you don't have to wear a night dress. Now you have like a night dress that looks like this, and then now you have to pull the night dress all the way down to the top. Now you're not dressed down there. So yeah, just get something. There are those ones with buttons, so you can like simply open the button and boop, breastfeed, so that you can enjoy the breastfeeding. Anyway, thank you guys so much for tuning in. Thank you for watching my video. I love you guys lots. I will post hopefully before the end of this month again. I don't want to make any more promises. I really don't want to make any more promises. So yeah, I will see you guys in my next video. Love you, and please do not forget to subscribe, like, comment, and hit that notification button so that it can notify you when I post, since I'm that person who will say I'll post in 5 weeks and then I don't. So like, just so that you're aware that this girl actually posted, you will be away. And don't forget to follow me on Twitter at Ntlantla. I will write it down there because it's a different Ntlantla. And follow me on Facebook at Masego Ntlantla, and on Instagram at m.86668a. I think it has an A at the end, but yeah. And don't ask me why the 666. It's my brother's burial site, so that's right there. Yeah, anyway guys, thank you so much. Thank you for tuning in. I keep saying thank you for tuning in, but like, I'm really thankful and grateful for tuning in. And please don't forget to let your friends know, and share, okay? Stop being so jealous. Share with those other pregnant women, okay? This is for you guys. This is for those pregnant women that I love so much with my heart. Bye.